Welcome to Build Your Best Business. I'm your host, Eric Holtzclaw. Build Your Best Business focuses on the entrepreneurial journey. What does it take to successfully start, manage, grow, and eventually exit a business? We're talking about a topic today that is top of mind with many of the business owners that I work with. I have in studio Will Hall. He is the CEO of HIPnation. So, Will, what's HIPnation?
It's a pretty timely topic, right?
It certainly is.
Well, thanks, Eric. So HIPnation is a healthcare solution company. What's HIP stand for? It's the first thing people say. So it was started as a consulting company, Healthcare Impact Partners, by some physicians and an attorney that felt like they had the answer for fixing our broken system. And after consulting for a few years, I came on and we put it operational, and we've been taking care of patients and physicians for, since January a year ago. So about 16 months.
Okay, all right.
Changing stories every day.
All right, so I realized it was a consulting first.
Yeah, so the physicians, were founded by 3 Atlanta physicians who 2 had written books, had testified on Capitol Hill. They were the talking heads on all the different news stations and things like that. And so we're really passionate about medicine. They're in the specialist arena, and so they have an entirely different kind of set of problems than a primary care physician. If you ever tried to get an appointment with a specialist, 6, 8, 12 weeks out,
right?
And that's just a symptom of the brokenness. And so these 3 guys in Atlanta were at conferences all over the country, started bumping into one another, realized that they had a similar mindset on how you could really fix the system, starting in the exam room with your primary care physician and not at a larger level and all the things that Washington's trying to do.
Yeah.
And so after connected with a healthcare attorney who's done a ton of stuff, he read the entire ACA. So I tell folks I know one guy that read the entire ACA.
That's a lot of reading.
Exactly, a lot of reading. But interestingly, the ACA actually encourages innovation at the state level.
Yeah.
And so we built HIPnation around some of those encouragements. And, the big picture, what we do is we remove insurance from outpatient healthcare, which is about 92% of healthcare.
Okay.
And insurance.
So you remove insurance from outpatient healthcare.
Exactly.
Okay.
Just like your car insurance is removed from your outpatient care of your car, oil change, getting tires and those kind of things. Car insurance is for accidents. Insurance really is for insuring against a low probability, high cost incident.
Right.
And you having a cold or allergies here in Atlanta during allergy season, that's not a high cost, low probability event. So why do you have to have insurance to see your primary care physician or to get medications for those things?
Got it.
And so what our physicians had seen is that insurance tends to drive up costs whenever it's a part of it. There's just a lot of administrative costs around that. So we pull insurance out of all of those things. We make it a cash-based system. The key foundation of what we do is we connect you to a 24/7 concierge physician, which dramatically changes our outcomes on our healthcare.
Okay, yeah, so let's talk a little bit about that. And I think what's been interesting, I work with a lot of business owners.
Yep.
And many people going into this year completely opted out of insurance.
Exactly.
They just said, I give up.
Very scary place to be.
Do it any longer.
Yep.
The deductibles don't make any sense. The premiums don't make any sense. And many of them have told me, I'm just going to risk it. I'm going to put the money that I would put into premiums into an account somewhere and hope for the best.
Yeah.
Like that's
had a lot of those conversations with folks.
Yeah. It's been even more this year. Because all the companies I work with are the founders and those kind of things. And so it's like, I guess my question is then, your system is insuring against only the big things. So then I'm just paying for stuff that I need to go do that's sort of regular maintenance, like I would with my oil change.
Yeah, well, what we do is we build that system and we go out and talk to the physicians and say, look, if you don't have to file with insurance and fight with insurance and those kind of things, and you get paid at the time of service, will you do your services for less?
Okay.
And physicians are as burnt out with the system as we are. That's really been a big learning for me in jumping into this a couple years ago.
Right.
Is that as consumers, I knew we were burnt out. Business owners, for sure, like you said, your friends and folks are stepping out of the system because you can't do it anymore. Where do you have double-digit increases year after year after year?
Well, and I was in somebody's renewal program the other day, and they're like, "Oh, it renewed. It was double. It was 20. It went by 20%, but that's just what's going to happen." I'm just like, that doesn't seem manageable.
Well, it's not sustainable. I just met with a business the other day with 18% increase.
Yeah.
And it's a little bit of the analogy of the frog in the slowly heating water, that folks say, well, it only went up 10% this year or 12 and it's going to happen. Well, in 7 years, you've doubled that line item on your P&L. And so I think what you're seeing is business owners are just saying, you know, if it's 300,000 a day in 6 years, I can't be at 600,000 and have a sustainable business.
Right.
And so businesses have opted out. It's very difficult for, you know, a lot of folks are going into jobs that don't provide benefits anymore.
Yeah.
You know, which has kind of been around forever. And so that's what our physicians are seeing as well. You know, they're small business owners too. You know, a physician that owns a surgery center and employs nurses and staffing, that's a small business. And so those guys were seeing the same thing. And so that's what we do is we go to the market. We build an entire ecosystem. We've gone and said to imaging companies, look, if our member walks in and pays cash for your MRI, how much will you take? $400. You can try to get into a hospital system. First, number one, good luck in calling and finding out what it really costs. But those things are $3,000 to $4,000.
Right.
So now you're getting an MRI for $400 or $500.
Yeah. So I want to get into how you got into this, but I have one more question before we go to that, because in our own, you know, process, many of the people that I talked to said, if I could just find, it sounds like what you have is just a catastrophic.
We put the catastrophic plan together. We went out to the market and found what we thought was a great catastrophic plan that fits with our ecosystem.
Okay.
So we built an ecosystem where you sign up with us. We're not insurance.
Right.
You get a 24/7 primary care physician. The statistics around how much healthier we are is better than any wellness program. And, you know, so many insurance programs, so many employers are providing wellness programs. The statistics around that are very minimal.
Yeah. Well, and that's the argument for it, is that if you're preventative, then you don't end up with the bigger events, right? That's what they say.
Except the problem is the wellness programs don't do that. You know, there's actually been great studies show no ROI.
Yeah.
But if you connect 24/7 to a primary care physician, you're 80% less likely to have surgery.
Oh, wow.
If you go in the hospital, you're in the hospital less days than if I don't have a primary care physician. You're 60% less likely to use an emergency room or an urgent care.
Okay.
So the statistics are phenomenal around when you connect, and then they're not having to deal with an insurance system. That you are their customer, and the relationship with our physicians changes everything.
Okay. And so then by participating in your program, then there's access to a catastrophic policy of some sort.
Yeah.
Because that's the thing, you can't find catastrophic policies.
Right. So what we went to the market.
If you're of a certain age, you can't find a catastrophic policy.
That's true. Exactly.
I got over a certain age. Isaac wouldn't understand that.
Right. So the company started initially, Healthcare Impact Partners, to partner with businesses, like you said, and impact their cost and their care.
Right.
And as time went, you saw what happened with the individual market last year in Atlanta. One of the big players pulls out, costs go up over 30%. So a lot of people had to exit that.
Right.
You know, think about a family of four, $2,200 a month and a $10,000 deductible.
Yeah, the math doesn't work.
The math doesn't work, you know, and there was a great story last year, a sad story, but insurance premiums now being more than mortgages, you know.
Oh, absolutely.
So people are like, well, I have a second home. It's just me paying a premium every month. And
so a
lot of people were exiting. And so we built a solution for businesses. And then when the announcement came out about the group leaving Atlanta, we said, gosh, we have an answer for those folks. Yeah. So went out to the market, we found an indemnity plan. So the way insurance used to be, you know, instead of going in the hospital and having a $10,000 bill and then it's allowed at 8 and adjusted to 6 and all those kind of things, you know, it's kind of follow the math. You can't follow it. The way insurance used to be, you went into the hospital and they said, Eric, you're in the hospital, we're going to pay $3,000 every day you're in.
Right.
We're not going to get a $7,000 bill and, you know, you're in network or this and that. So we went to the market, found what we think is a great plan. It's with $1 billion insurance company. The key to make it cheaper is it's not ACA compliant. So they don't check all those boxes that drove the cost up in many cases. And so the economics for a family of four, instead of the exchange at $2,200 a month, I'm 48, wife and 2 kids, I can have HIPnation and that product for $1,000 a month. Now I've got a 24/7 concierge physician for me, my wife, and both kids. That means I have 24/7 access to the physician. I don't pay a copay to see them. I don't pay co-insurance. I can call them. I can text them. I can do whatever. I'm getting access to that care. And then when I go in the office, I pay as I go.
Yeah.
So I'll pay for the flu test.
Right.
You know, if you don't go in the office, you don't pay.
Yeah.
Then my physician says, well, you need whatever the antibiotic may be. We've partnered with the Academy of Independent Pharmacy. And you'd be shocked. There's actually another article, I think it was New York Times, that consumers are figuring out if you pick up your medication and pay cash and not the copay, you save money.
Right.
And so we saw that, but the Academy of Independent Pharmacy is doing some phenomenal things to help consumers be healthier. There's so much of, they call it polypharmacy. You happen to be near this grocery store that day, so you fill your prescription there, and then a month later you're at a different one. And so no one is really saying, okay, well, let's look at the 3 medications that Eric is on, and maybe they don't interact very well.
Right.
So we've had just phenomenal stories of our members coming in. They get our primary care physician. We connect them to the pharmacist, so to their own pharmacist. The 2 docs are connected via cell, and so we've had great stories of the pharmacist calling up and saying, hey, I think this medication, we could actually probably switch it to a different one. We'll save them a ton of money, and there's a different, we can take out some of those side effects.
Yeah, well, that used to be how it was. That's how it was. How did you get involved with the business? What were you doing before?
Well, I'm a physical therapist by trade, so I got to take care of patients for 10 years, loved it. My career kind of went into more of the business and operations side, so I did that for about 10 years. And then about 2 years ago, my company sold. They didn't need 2 of me, so I got to figure out over a summer with my kids. Was fantastic to say, okay, well, what's next? And a buddy of mine is one of the founders.
Okay.
And he called me up, said, hey, let's have coffee. And he said, I want to tell you about something I'm doing. I'd love to be a part. And we sat down at coffee, and he said, we have the way to fix the healthcare system.
Yeah.
And I said, right. Sure you do. And literally drawing out on a napkin, right, as a lot of startups do, he drew it all out and said, this is how you can really impact people and impact cost and impact care for people. And I said, it just can't be that easy. He said, no, the fix is simple. It'll be really hard.
Right.
Because, we say it, we only speak insurance. We speak deductibles and, what's my copay and what's the network and all those kind of things. And so that's a high hurdle to help people start to think insurance and healthcare are radically different.
Yeah.
And if you listen to any news show, it doesn't matter where you lean politically, just listen when they talk about healthcare, they'll interchange those 2 words, healthcare and insurance.
Got it.
And healthcare is when you call your doctor and you're sick. You have a healthcare issue. First question that's asked is,
do you have insurance?
Do you have insurance? What's your insurance?
How much
has your insurance changed?
Right.
All of those things. So that shows you the system is completely misaligned. You called with a healthcare issue. It immediately became about how's this going to be paid for it.
Yeah, and it's an interesting, and so we're about to get a commercial break, and I want to ask you a little bit about getting some of the players to participate, and then the battle of, in so many places now, there's this inclusiveness happening. So, for example, I bought a car recently, and my maintenance is included for the next 8 years.
Yep.
So there's a mental mindset of going towards almost the inclusive, which is the old way of doing it. But what you guys are proposing is just go pay for the things that you would normally pay for. It doesn't make any sense, right?
So many folks hear our model and they say, well, that's how it used to be.
Right.
And our tagline is healthcare as it should be.
Yeah,
It used to be that way. I just had a gentleman the other day signed up and he sent an email. He said, I love what you guys are doing. This is how my dad practiced medicine 60 years ago. I watched him.
Yeah, absolutely. All right, we'll be back in just a second. You're listening to Build Your Best Business. We're talking today with Will Hall. He's the CEO of HIPnation. And we'll be back in a second.
Eric, tell us about Laddering Works.
So Laddering Works is a company that helps other businesses in one of 2 ways.
Okay.
So your company is either growing and you're not exactly sure how to keep up. So you need to scale operations, maybe raise some money, those kind of things.
So growing too fast.
Growing too fast. Growing too fast. You got kind of structural, you walk in every day, there's a fire. You've been doing it longer than 3 years or 1,000 days, and you still feel like you can't step away from the business and take a vacation. So we help companies on that side. So sort of operational support, looking at their financing, seeing if there's a way that we can help them, get to the next level. Or you're a company that's not doing any marketing at all. So you are maybe stalled. Your business has gotten to a certain level. You make a certain amount of money every year, but you've never gotten above that. And we come in and build marketing structure. So both of them are operational at the end of the day. It's about creating a process and a way to approach it that's strategic. It's that owners don't often know how to do both of those. So they're really good at sales, which means they may need operational structure because they're out signing more customers than they know what to do with. Or they've built a beautiful product that's the best kept secret. And so they need somebody to come in and help them market that product. And so that's the kind of businesses we look for. We come in as a stopgap, and we work with a company for somewhere around 12 to 18 months typically, solve those problems for them and leave them better than we found them. And we're back. You're listening to Build Your Best Business. I'm your host, Eric Holtzclaw. We're talking today with Will Hall. He is the CEO of HIPnation, and he is hip.
My teenagers don't think so, but I'm trying to be.
So talking about healthcare and the difference between healthcare and insurance and the program that they've put in place. So what's interesting to me, so you go have this coffee and they draw it on the back of a napkin and sounds like a good idea. Then you have to convince some other parties to participate. So you've got multiple players in this. You've got, the healthcare people, potentially the insurance people. You've got where did you start? Did they laugh at you? Did they think it was a good idea? Like, how did you get them
great
around
point.
it?
First, I started by convincing my wife that it was time to do a startup with one about to go to college and another one in high school.
Yeah.
And, hey, here's the perfect time.
Right.
And, but, she saw it, my kids saw it, a chance to just truly make a change for people. It's a great opportunity. And the founders, phenomenal men, who want to make a huge difference. And, as our chief medical officer says, he's like, look, I could do medicine and be fine.
Right.
But I have 2 little girls. And if somebody doesn't fix this system, what are my little girls going to grow up in? Yeah. And so, that's kind of the DNA of the folks who founded the company. So for me, it ended up being kind of a no-brainer. It was let's try to do something that truly impacts people. And so we jumped in. We first built an employer solution, which took about 10 months to build that. So we've got a stop loss and a reinsurance company. We took the model to, because the model makes sense, right? If you pull out all of these extraneous costs out of the system and it gets cheaper, then you can make insurance cheaper. Right. So the average physician employs about 5 people to manage the insurance industry. So in our primary care, because there's no insurance there, you pull all that out. Well, and then you pay $100 per month, but there's never a bill for seeing your primary care physician. So the costs come down. And then what's in it for the specialist is our urologist founder has about an 8-week wait because 80% of the people that he sees don't really need to be there. And we found that with everything from our cardiologist to dermatologist.
80% of the people don't need to be there.
Right. So the way the system works is our physicians, an average appointment is about 8 minutes. Right. Uh-huh. And so unfortunately, primary care physicians have in many cases become triage points. If you're seeing 25 or 30 people a day, Eric walks in with a headache. Well, I've got 6 people after you, so you get to go to the neurologist, and Will walks in, he's got a stomach ache. I go to the GI guy, and that's what they're doing all day. They're not practicing to the full extent. Primary care physicians are really, really smart people. Right. But if I only get 8 minutes with you, I just don't have a chance to figure out exactly what's going on. So
I'm just referring it out.
And so now the specialists have backlogs, right? Because they're seeing all of us that don't need to be there, but that's the way the system is. So now I'm taking time off from work. I'm going and having to fight traffic and fight a parking deck and a copay and all those kind of things. So one of the things I've learned in working with our physicians is if you've ever gone to a specialist and they say, Eric, this is interesting. Why don't we watch it for a couple of months and come back in? You didn't need to be there. Yeah. In all likelihood. Right. Or if the specialist
cancel the appointment.
Well, you cancel the appointment. Right. Exactly. That's another issue. And then the second thing is if they said, if a specialist physician says, here, let's try you on this medication for a couple of months. Yeah. You likely didn't need to be there because those things can be taken care of with your primary care physician. Okay. So we connect our primary care physician to the specialist for curbside consults via their cell. So our docs, one of our physicians says, I've got the best specialist in Atlanta in my pocket. Yeah. You walk in and they, your lab test comes back, and we just had a great, story. We talk about HIPnation stories all the time, just because everyone has a story about how the system is not working. Right. And what we're getting is the system of how it is working for individuals, for our physicians. But one of our physicians was telling a story the other night at open house where had a patient come back. lab test was a little elevated in the cardiac area. She called our cardiologist and said, "Hey, this is what's going on. Do you think I need to send Will to you?" He said, "No, think about it this way, do this." And this is one of the Atlanta's top family physicians, been voted that multiple times. And she said, "It was really cool. I learned something. We saved our patient from having to drive and all these kind of things." And so now the specialists love it because you're not seeing me. You don't have a full exam room because we get frustrated, right? We sit there, we're waiting because they're backed up. They want to take care of the people that really need to be in their office.
Yeah.
So the specialists love it. Our primary care physicians, instead of taking care of about 3,000 people and having 8-minute appointments, now they have a panel that's only 700 folks. And so you get their cell phone. And one of our docs said the other day, she said, "I have more joy in medicine in the last 6 months than I've had in 15 years.
So is it because of the way that you've established the program so that they don't have to worry about managing so many to make the same number? Is that
sure?
Yeah.
Well, when you pull, those 5 people out of an office that are dealing with the insurance industry, that's all overhead.
Yeah.
And so now you can just take care of patients, not deal with the insurance stuff and the administrative things and all those kind of things. So then the economics in that office work way better. The physician actually gets to practice medicine.
And so then you're looking for physicians that are working exclusively in your network then, yes?
Well, we actually are partnering with some, the foundation is direct primary care.
Yeah.
It's one of the fastest growing segments of medicine because physicians are burnt out.
Right.
When I said we're frustrated with the system, imagine going to medical school with a calling to serve people and take care of people, and then you're on this hamster wheel that just doesn't allow it.
Oh yeah,
So,
I mean it's broken on all sides. My sister's a nurse practitioner, so I see it from that inside. And
You've
a friend
heard
of mine's
about
a
it.
nurse, and those kind of things. So it's such a broken process, or feels so broken. It's one of those things that you walk up to and you just look at and go, I don't have time to figure this out.
That's where we say, when you really look at it, the fix is simple. You just remove insurance from all these things, where it shouldn't be, and you use your car insurance. It's the exact analogy,
right?
You don't go to get your car insurance and pay a copay and then give them your USAA card and expect a bill 90 days later. If you did, that oil change would be much more expensive.
Yeah.
So it's the exact same analogy. It really works. And so we just pull insurance out. We go and just cash-based contracting with folks. We take that because now we're taking the burden off of those guys as well.
Yeah.
The pharmacist fills the prescription. Eric pays $15 and it's done.
Yeah.
Right.
Yeah. So, okay. So I get that so convincing. That was the first group that you went out to start convince to participate.
Yep.
From there, then who was next? What did you?
Well, interesting. The company was focused initially on businesses, and it took us about 10 months to build that business solution because that part is complicated when you're starting to talk to actuaries and reinsurance and stop loss and all these kind of things. So it took about 10 months, and we found a partner that's been around 30 years, have $1 billion company behind them, reinsuring. And we said, we have it. Fantastic.
So talk to me about that a little bit. And it's just because I'm so close to the experience, right? I mean, being self-insured and going through the plan. So when someone's out there and they think, I can't find it, how do they know to go to, that's the disconnect I have right now, right? It's like we have a common place we go to look for these kind of things.
Right.
And I don't actually do the look, so I should probably say that. My wife goes out and finds it.
Which is about 80% of cases.
It comes back and says, I can't find it.
They do the research, they look, and those kind of things.
What should they be researching instead? Like, how should they look for an alternative? Because we have this honest, it's like, we're too old. We can't just get a catastrophic policy.
Right.
These are the choices. And we were like, okay, we opt out.
Well, of course, the place to look is HIPnation.com.
I hear you.
We have the answers for you. But when you're in that system, that's what we say. We only speak insurance. That's kind of what we've all grown up with. Certainly our generation has grown up with insurance and copays and deductibles. And, I remember treating patients initially in physical therapy that there were no copays.
Yeah.
And then now, copay may be more than, the majority of the visit.
Right.
So, in 20 years. So we only speak insurance. So certainly you go out to that sort of market and there's not individual type policies anymore. You have the individual exchange and that's it. And so, like you said, people look at those costs and say, I just cannot do that.
Yeah. Well, it doesn't make sense. Business owners look at ROI and we're like, no, that doesn't.
It doesn't make sense. Exactly. But everyone's kind of walking around with a hope and a prayer and the fingers crossed saying, I hope
nothing happens.
Nothing happens.
Yeah.
Exactly.
Right.
And a medical issue, catastrophic, is one of the one of the top ways people lose their businesses in bankruptcy and those kind of things. So, so shamelessly plugging HIPnation.com, but that's what we do. Is we went out to the market. We've worked with brokers to figure out what is out there. And so we found an old style indemnity plan, like we said, the way it used to be, but that plan has $1 million per year per family member. So my floor, everybody's got $1 million of coverage in a year, $5 million lifetime. And you are 0.01% likely to spend $1 million in a year, you know? So it's risk, right? A lot less risk in having that than saying, well, I'll just go without anything, you know? So you're right. Your wife would have a tough time going out and finding something in the market. We just met with a group of brokers yesterday in Atlanta who had not heard of that company. The company's been around years. It's $1 billion company. And we just did the research to say it really fits well with us, because $1 million of coverage a year. And then every time you access our system, you send them a receipt for what you've paid, and they're going to pay you dollars back. Now, it's built for the normal insurance system. So we've had some great conversations with those guys. We think they can pull their rates down even more. So they reimburse you $350 for an MRI. Well, if you went and got a $3,000 MRI and you got reimbursed $350, you're thinking, that's not such a great deal. But if you go get a great $500 MRI and get reimbursed $350, that's a pretty darn good deal. That's right. So we've done all the legwork in finding the MRI centers, finding the labs that'll do cash-based labs, finding partnering with the pharmacies, those kind of things. So you're right. I mean, it's very difficult. I feel like I've been in a learning, well,
you're evangelists almost. I
am. I mean, I totally believe in what we're doing, and I've seen the stories, of radically transforming. You take a family of 4 and put $1,000 a month back into their budget. That's transformational for a family, you know, and I've seen it for physicians. When a physician, one of our docs said, I was just going to retire early. I could not do this anymore. Driving home at night crying because of the system. And now it's just saying, the joy I have. So changing those stories is phenomenal. I mean, I love it. We are really changing, and small businesses too. Take a small business and save $4 or $5 grand a month for a small business.
It's huge.
Again, big.
Huge in the difference in how they might decide from margins and all those things.
Sure.
So future for you, other than evangelizing, going out and getting the message out, because that seems like that's something you've got a challenge you've got to overcome, right?
Sure.
What are some other things you guys are thinking about?
Well, is expansion for sure. We plan to be in Savannah, Macon, and Athens by the end of the year. We already have physician contacts. But again, I go back to physicians being so burned out. Good doctors know good doctors. And so we have physicians that have started to hear about us. One of our founders started Docs for Patient Care, physicians in all 50 states now that are that. And it truly is Docs for Patient Care, about us. So they started that years ago. So we've got physicians from around the country calling and saying, when are you coming here? When are you coming here? So we'll be expanding in Georgia this year, and then we'll be outside of Georgia next year, where we've got some strategic partners already that are ready to go, and just taking what we're doing and taking that story, putting it in a different state, different business owners. Every business owner knows other business owners, and once they see the difference, well, I just say, hey, Eric, do you have some buddies that own businesses? Absolutely. Here, call these 3 guys. And then families, one of the ways we're growing is that family that we put $1,000 back into their budget every single month. They go tell all their friends and say, you got to check this out.
Right.
So.
Okay. Well, very cool. Well, I wish you the best of luck.
Thanks.
It's a very interesting and needed thing to figure out how to address it. It's, as you think about next generations and even business owners deciding either to opt out. Like it's one of those things that, gets into that world of, do we do this, or do we not have a good employee because of it for some reason?
Absolutely.
So,
no doubt. And then they have the dollars back into it. I can give raises. I can open a new store. I can buy new equipment.
And the numbers that you're talking about for some companies is the margin.
No doubt.
It is the margin.
Yep.
There's that's where that is there. And it doesn't make sense. Like, it's like, I should just go to work, right? I shouldn't be doing this. Like, that's the decision. And a lot of the companies I'm working with, when I'm first entering, the owner is making a choice of, am I going to stay in, or I'm going to stop doing this? And so we're trying to make things better. And one of the things to make it better is to be able to provide these kind of benefits to their employees so that they stay and feel vested.
Sure.
But it becomes like a bridge too far, you know?
Well, the first restaurant we signed up was in that exact spot. He was above 50, so he's above the ACA mandate, and you're either going to pay the penalty.
Right.
And so he got to us and was either I'm going to have to lay people off, cut hours back to get back below that number. Am I going to have to close one of the restaurants? I cannot continue to do this.
Yeah.
And thankfully his broker had heard about what we're doing and brought us to the table. And so, now his employees have a concierge physician. He's out of the penalty. They have better health care than they've ever had.
Yeah.
That's gratifying.
Yeah. Very cool. You've been listening to Build Your Best Business. I've been talking with Will Hall. He is the CEO of HIPnation. If you are interested in figuring out how to solve some of your health insurance problems, you should reach out to them. Until next time, what are you going to do to build your best business?